Hello, good evening to Sahilmi and everyone's here. My name is Stacey James John, and I am your moderator for today's webinar entitled Are You Living a Healthy Lifestyle? I want to ask to you all, are you living a healthy lifestyle? Are you sure you are living a healthy lifestyle? Okay, today's we brought to you four important person to talk about a healthy lifestyle. Let me introduce to you all. Our first panel, Dr. Nur Aida Binti Azmi, nephrology doctor. Second panel is Miss Maswia Binti Abdul Hamid, a dietitian. Third panel is Sir Muhammad Daniel bin Taufik, fitness trainer, and last but not least, panel 4 is Miss Atika Mailon, fitness trainer also. Okay, without wasting our time, let me invite Dr. Nur Aida Binti Azmi. Hello, doctor.
Hello and good evening.
Okay.
First, I would like to say thank you because inviting me. As the Miss Moderator mentioned earlier, my name is Nur Aida Binti Azmi. I'm a nephrology doctor who treats kidney patients. As we know that every day there is an increase in kidney patients regardless of age, young or old, and they need dialysis treatment because the kidney no longer can be used. It's a bit sad for me actually, going back to our topic webinar today, which is are you living a healthy lifestyle? Do you? If yes, I want to say thank you for taking good care of your health.
Okay, doctor, I want to ask you, what will happen to our kidney if we don't practice a healthy lifestyle?
If you are not practice a healthy lifestyle, you may get chronic disease such as kidney failure. Then what is the cause of kidney failure is, in fact, there are many factors that cause kidney failure. First, diabetes and uncontrolled high blood pressure. Next, what is the cause of diabetes and high blood pressure? The main factor is in terms of our own lifestyle. Every morning, I'm sure many Malaysia and Audian Hills like to eat nasi lemak, Milo ice, teh tarik, roti canai every morning, right? In the afternoon, a plate full of rice, curry, and fried chicken. In the evening, eat fast food, and before bed, eat cake. They say it was a dessert. So, how much sugar and calorie are in the food you eat that day? I'm not forbidding you to eat, but to eat in a controlled manner. When the number of calories per day exceeds the number of calories needs by the body, it will lead to weight gain. Plus, I know we are too lazy to exercise, and finally, we are becoming the Malaysian version of Doraemon.
Yes. Okay, doctor, I want to ask you another question. How do we detect that our kidneys have problems?
The first that you are, how we detect that our kidney have the problem. First, that you are a person who pee often at night. When at night you will often wake up from sleep because you want to pee. Have you ever read, if you love your kidney, drink less water at night, but drink a lot of water during the day. The second sign is in a itchy feeling on the skin, neck, the legs and face are swollen but not swollen due to fat. There is a difference between swelling due to fat or water, okay? Then quickly feel tired and sleepy. Waist pain, and the most noticeable sign is a lot of protein urine. I also have experienced this case. I lost my mom when she was 49 years old because of kidney disease, and I saw the suffering experienced by my mom during treatment, and the happiness of living as a normal person have been lost in getting the disease. I also admit that my mom way of eating the eating was wrong when she was still having a good health, and only when she was sick she realized to change her lifestyle, but it was too late. too late. As the saying goes, prevention is better than cure. So I would like to call all viewers of this webinar to take care of our health. Take vitamin C from fruit, not a supplement or whatever. And lastly, I want to give a few tips of kidney care and health. First, practice a healthy diet. Second, always do kidney and health checkup. Third, more actively and do exercise. Fourth, get enough sleep. And fifth, quit smoking. This is for guy, okay? And lastly, drink more plenty water. That's all from me.
Thank you, Dr. Nuraida, for the interesting facts about kidney. I hope all of us realize that it is important to us to take care of our kidney before it is too late. Okay, now I want to invite Ms. Maslia binti Abdul Hamid, our dietitian. Hello, Miss.
Hello, everyone.
I want to ask you a question. What is the most important aspect of living a healthy lifestyle?
Okay, I will answer the question given by moderator. Okay, the most important aspect of living healthy lifestyle is it will balance diets. Okay, it's describe the consumption of various type of the food is according with the Malaysian Ministry of Health food pyramid. Among the meals that should be consumed based on the food pyramid are carbohydrate such as rice or cereal. This is because the carbohydrate provide energy to our bodies, allowing them to carry out various daily tasks. And following that, the recommended food intake based on eating is vegetables and fruits. And also, based on the food pyramid as well, it has less intake of food that the content such as fats, oil, salts, and sugar. Okay, it's because it can prevent various chronic disease such as heart attack, diabetes, and more. Okay, you can see in the PowerPoint that has been displayed that is a balanced food pyramid.
Okay, Miss, thank you. Any tips to obtain nutrient without being hungry?
Okay, I will give tips on easy way for the body to obtain the nutrition it needs without being hungry. First, take care of meal time. Okay, the first thing that I need to emphasize in the matter of the nutrition care is a regular meal time. Breakfast is the most important meal time, but it's often slight due to limited time. Okay. For your information, a good breakfast will ensure your body get enough energy and nutrition to carry out the daily work more productively. And the same goes for lunch and dinner time. Avoid lunch and the dinner time that are too late than the norm. Okay, the ideal lunch for me is 12 noon to 2 p.m. While the ideal dinner time is between 6:30 p.m. and 8:30 p.m. Okay. Tips number 2, use a KKM healthy plan concept. Let's concept, okay, to make easier for the public to practice a balanced diet. The Ministry of Health Malaysia (MOH) has introduced for Pinggan Sihat Malaysia. It's a simple approach for people to ensure food choice during a main meal time are balanced and appropriate quantity. Okay, Pinggan Sihat Malaysia emphasize the concept of the quarter half. The first half is filled with carbohydrate, so such as rice, bread, noodles, cereals, of which the food group is the main source of energy our body. For the selection of rice type is brown sugar. Brown rice. Okay, brown rice and white rice actually come from the same source, which is a rice, but brown rice, also known as ampellage rice, contain more fiber, iron, manganese, phosphorus, vitamin B1, B3, and B6. Okay, the other half of the plate is the filled with a sort of fruits and vegetable that are rich in a fiber, a vitamin, and a mineral to add various bodily function. And tips number three is avoid calorie. Okay, the portion of each food on our plate should also be taken of to avoid excessive calorie intake. For ideal carbohydrate intake is always an approximate hand grip size. Okay, excessive carbohydrate intake will not only lead to excess blood triglyceride (TG) reading. Okay, estimate for a protein use the size of the palm, excluding the finger. The approximate size of palm is to determine the size of a serving of fruits and vegetables. And finally, why is not wrong to indulge in favorite food? On the occasion, we must take more care, healthy and balanced food choice for long-term health. Okay, when selecting daily food, keep the concept of balance, moderate in mind. If you need help choosing a good and balanced diet, consult a nutrition or a dietitian at a hospital near you. Okay, that's all. Thank you.
Thank you, Miss, for sharing the interesting fact about tips. Okay, let me invite our third panel, Sir Muhammad Daniel bin Taufik. Hello, sir.
Hello, moderator. How are you?
I'm fine, good. How are you?
I'm fine too.
Okay, I want to ask to you, what should we do or what can we do to keep our health maintained?
Okay. Thank you to our moderator for the question that given to me. Okay. What we can do to keep our health maintained. Today, I will share to all of you about doing a physical activity to keep our health maintained. Okay. Hi everyone. I hope all of you are doing fine today. Okay. What is a physical activity? The meaning of the physical activity that includes all the body movement that use energy in a daily life, such as work, recreation, exercise, and sport, and so on. Okay, like Dr. Aida said, our Malaysian like to eat a nasi lemak, like to eat junk food, like to eat Korean food. Okay, that is a not good food to our health. Okay, that food can lead us to the obesity, diabetes, and so on. Uh, that increase the risk of getting the disease such as heart diseases, high blood pressure, diabetes, and joint pain. Okay, next, I will share to all of you what we can do physical activity. Okay, doing a physical activity, the benefit that we can get we can make our health and stamina keep maintained at the same time, our body getting fit. Okay, other than that, we can get the best our body goal that we dream. Okay, what we can do for the physical activity? Okay, let's go. First, we can perform like to moderate physical activity for at least 30 minutes per day. Okay, the duration of this activity can be summed up throughout the day at least 10 minutes each time. Okay. Doing physical activities, I will share to you two types. First is a light activity and second is a medium activity. Okay, first light activity, we can do a 16 minutes every day. Example, walking, stretching activity, light gardening activities. Okay, next, a medium activity, we can do a 30 minutes daily. Example like walk fast, cycling, swimming, dancing, jump ropes, and such on. Okay, I would like to share to all of you a schedule that we can use to doing a physical activity in our daily to keep our health maintained. Okay, first, I would like to use a FITT. What is a FITT? First, F a frequency is how much we do the exercise 3 or 5 times a week. Okay, second, I, intensity. This is the effort we do a sport or activity, you will sweat and can take a deep breath comfortable. You can still talk about cannot sing during the activity. Okay, T, the times. How much time you can use, you can take to doing the physical activity or workout. I will suggest to you just take 20 minutes for the day, for each day. Okay, second, T is a type. Okay, type is what is type of sport you can do. Okay, example like playing a football, playing a netball, go to the gym, make some workouts, and such on. Okay, that's all for me. My sharing session to all of you, what we can do, the physical activity to keep our health maintained. That's all for me. Thank you.
Thank you, sir, for giving us some examples of physical activity to maintain our health. Okay, last but not least, let me invite Miss Atika Mailon as a fitness trainer. Hello, Miss. How are you?
Hello, I'm good.
Okay, I want to ask something. Can you share with us, with all of us here, about obesity?
Okay, thank you, moderator, for your question. And good day, everyone. My name is Atika Mailon. I strongly agree about the point that the other panels have described. Have you ever heard about the statement "fat is awesome"? Actually, I previously stated that fat is awesome as long we are healthy. But do we live a healthy life if we are fat and obesity? As we know, obesity is affected by several factors. Maybe it's because of genetic or maybe it's from our diet. The point is obesity is not healthy. This is because obesity is the cause of complication of other disease, as the other panel mentioned earlier, as such as hypertension, heart disease, and so on. We know whether we are obesity or not by calculating our body mass index or BMI. Let me show you how to calculate your BMI. Okay, BMI equals to mass, make sure in kilogram, divided by height times height in centimeter. So the normal BMI is between 18.5 to 24.9. So don't forget to calculate yours. We already heard about the diet that was recommended by other panels. I admit there are many ways to do diet, but I strongly not recommend it if you do an extremely diet. Since I have experienced how to live a healthy lifestyle by doing diet, here I share what I have done throughout my my diet. Number one, cut sugar. Stop eating foods and drinks that are high in sugar. Number two, drink 2 or 3 liters of water a day. Number three, don't skip your breakfast. Number four, get enough sleep and don't be stressed. And last, exercise at least 3 times a week. Okay? Here I share these tips with you because I myself have practiced this diet. I managed to lose 16 kilograms of weight while following this diet. But remember, diet aims to be healthy. Being slim is a bonus. That's all from me. Thank you.
Okay, thank you, Miss Atika Mailen. Okay, so for today's conclusion, we need to take care of our body by living a healthy lifestyle. If do we cannot do anything and anymore if it is too late. Okay, thank you.